Welcome everyone to the second U.S. Department of Energy Former Worker Medical Screening Program webinar series event. We are very pleased to have so many people joining us today for this overview of beryllium and the BeLPT. My name is Zach Hubbell and I'll be hosting the webinar today. I'm a program coordinator for the National Supplemental Screening Program, which is one of the 6 DOE Former Worker Medical Screening Programs. Before we get into the presentation, I'd like to go over some important information about today's event. First, we recommend connecting via only one device to avoid audio interference issues. Please also note that microphone and video capabilities have been disabled, so you will not be able to unmute yourself or use the WebEx chat feature. We have allowed some time at the end of the presentation for our speakers to answer questions. You can submit your typed questions at any point during the webinar using the Q&A feature of the WebEx platform located at the lower right of your screen. Please be sure to select the All Panelists option when submitting a question, and note that your questions will not be visible to other attendees. We'll do our best to get to as many of these as we can. You'll be asked to complete a brief feedback survey at the end of the webinar. Your web browser will redirect you to the survey at another website when the webinar has concluded. If you need to leave the webinar early, please do so by clicking the red button with an X on it at the bottom of your screen, which will also redirect you to the survey. A recording of the webinar will be made available at a later date. And finally, if you experience any technical issues, please disconnect and rejoin using the web link sent to you. Without further ado, it is my pleasure to introduce today's speakers. Dr. Jamie Stalker is the Senior Director and Principal Investigator of the National Supplemental Screening Program. She has extensive experience as a Site Occupational Medical Director in the Department of Energy Complex. Prior to joining the NSSP in 2021, Dr. Stalker spent 20 years practicing occupational medicine, including 15 years managing an on-site occupational health program at a DOE facility. Dr. Stalker is the former Medical Director for the ORISE Beryllium Laboratory. Dr. Lee Newman is Distinguished Professor of Medicine and Public Health at the University of Colorado. A pulmonary physician and occupational health specialist, he is recognized for his contributions to our understanding of how beryllium affects the immune system. He pioneered the use of the beryllium lymphocyte proliferation test, or BeLPT, leading to the current definitions of beryllium sensitization and chronic beryllium disease. Dr. Newman and Dr. Stalker will talk about a range of topics pertaining to beryllium and the BeLPT, beginning with a discussion about beryllium's uses, followed by its potential health impacts, specifically beryllium sensitization and chronic beryllium disease. We will then hear about the beryllium lymphocyte proliferation test, including how to interpret the different types of results. And finally, our presenters will discuss what to do once you've received your BeLPT results. And with that, I'll turn it over to our speakers.
Hello, everyone. I'm Dr. Jamie Stalker, as was just introduced, and I'll be starting the presentation today with some beryllium basics. I apologize, I'm a little hoarse this morning, and I'll be turning my video off because I am going to be sipping water and I don't want everyone to be distracted. I thought before we took a deep dive into the health aspects and medical testing related to beryllium exposure, that it would be only fair to the poor beryllium metal to give it some credit and help everyone understand what it is and why it has been used in the past and why we continue to use it going forward. I'm going to stop my video now and we will get going with this first slide. So the first thing we want to address is what is beryllium. Beryllium is the lightest of the alkaline earth metals. You'll see this in the periodic table in front of you. It is an atomic number of 4, and this group of alkaline earth metals is known as having the quality of easily giving up electrons, which gives it a lot of the properties that make it useful. Where does beryllium come from? Well, I'd like to say it comes from stardust. Beryllium is a very rare metal, and it takes a supernova and the energy that comes off of the cosmic rays as a result of that supernova to have enough energy to break down large molecules, which are created during the supernova into smaller elements like beryllium. So that means what's created at a supernova is what we have. And it doesn't occur, beryllium does not occur freely in nature. It's a minor constituent of ores, commercially mainly beryllium ore called beryl. This ore is widely distributed in the Earth's crust and is a mineral that contains a significant amount of beryllium, but the ore itself only makes up 0.0002% of the Earth's igneous rock. To create the shiny rock that we see here on the right, it requires a complex series of chemical reactions, precipitations, and extractions, and which have ultimately resulted in a white powder, which can be used in ceramic formation or transform into the shiny metal that we see here on the right. We can move to the next slide, please. So I'm a very visual person, and I think pictures help us understand things better, and that is the purpose of this slide. On this slide in the center, we see the Delta, Utah beryl ore mining operation. This massive mine exists to access just a 10-foot strip of the mineral beryl ore. The picture in the upper left on the slide shows you what the ore looks like in its raw state. There is only 0.25% of beryllium in this ore. So it takes about a ton of ore to produce 5 pounds of beryllium. And it's important for everyone to know that the United States produces over 60% of the world's beryllium. Once beryllium is produced, it is commonly used with other metals to produce metal alloys. For those that don't know, alloys are metals, which are mixes. We all know about brass, and brass is an alloy of zinc and copper, as an example. On the lower left picture, we see beryllium copper alloy in its pure form, and then that is used to produce materials and parts that are in the picture on the far right. You can see in this picture that includes many products, including circuit boards, sports equipment, and tools, to name a few. So the real question is, why do we put so much effort into producing beryllium? And why are we even using it? Well, it's because it has amazing and valuable qualities. The beryllium metal is a third as heavy as aluminum, 6 times stiffer than steel. It has a very high melting point, 1,285 degrees centigrade, compared to other light metals, and it holds its shape through a wide range of temperature variations. High heat absorption capacity is also a characteristic, which means it can serve as a heat sink. It's non-magnetic, it has dimensional stability, it has good corrosion resistance, and high permeability to X-rays. And very importantly, it can be machined to close tolerances. That means if you expose this metal to a laser, which would typically heat up the metal, it's not going to deform in any way. And that is not the quality that we see in other metals. We can move to the next slide. So with all these qualities, there are many applications where beryllium is the ideal metal to use. These include those industries that we've listed on this slide. And you should note that this list is not all inclusive. So aerospace industry is going to use it, for example, for aircraft braking systems, engines, satellites. Dental labs will use it for alloys and crowns and bridges and dental plates. And nuclear energy industry uses it for heat shields and in reactors. Unfortunately, the industries on the slide are also those where beryllium-related health problems have been found, which will be the focus of our discussion today. We can go to the next slide. And of course, as I love pictures, here's another picture slide. So this is some visual examples of beryllium use. We can see the cell tower for telecommunications, tools, electronics, defense use in the missile silo picture there, aerospace, we can see the fighter jet. But my favorite on the slide is are the two pictures on the far right. The Webb telescope's main structure is made of beryllium, and the Webb telescope has been in the news a lot. This is seen in the top slide, which shows the beryllium hexagonal metal skeleton that holds the gold mirrors in place. Since this telescope is an infrared detector in space, it utilizes all the qualities that I have listed earlier for beryllium, from its weight to its purpose as a heat sink, to high temperature and low temperature tolerances. And there's a great YouTube video that is called Elements of Web, Beryllium. And it's great to watch, and you can find out much more detail about the Webb telescope and how it uses beryllium. Next slide. So now we're going to transition to beryllium use at Department of Energy sites and try to answer another question, which is, at what sites was beryllium utilized in the DOE complex? This chart shows the numbers of workers in the beryllium-associated worker registry at the sites in the complex. This data is through the year 2018, and it's important to realize that not all DOE sites contribute to this registry. These bar graphs, which show you can look at the top and look at Hanford, which had the most workers participating in their beryllium registry, all the way down to the bottom for the sites, for example, like Fermilab, that only had 29. This represents active workers who were enrolled in medical surveillance programs due to their potential for beryllium exposure and were being screened for beryllium sensitization and/or disease. Unfortunately, this program didn't exist prior to 2002. And there is also, unfortunately, very limited data for many sites concerning beryllium utilization, either from industrial hygiene exposure monitoring data and other resources. So as a formal worker program, we're really dependent upon what our participants can tell us about their work during these dates and exposures for times prior to that 2002 registry. What we have learned and what I can tell you is that workers from a wide range of DOE sites have worked with or around beryllium. And according to the BAWR, over 2/3 of beryllium sensitized and chronic beryllium disease cases occurred in workers with no exposure monitoring data, including some whose jobs had no expected risk of exposure. We will be coming back to this topic later in the presentation, but right now I'm going to turn the presentation over to Dr. Lee Newman. He is an internationally recognized medical expert on beryllium and beryllium-related diseases, and I'm also proud to say my co-PI for the NSSP Former Worker Program. Lee?
Thanks, Dr. Stalker. Hi, everybody. I'm really happy to be here with you today. My relationship to this medal goes back to the mid-1980s, and that'll come up a little bit during this presentation. Let's sort of extend from where Dr. Stalker was just talking and discuss a little bit about the range of risk for workers. As she was saying, there are some people where they have no known exposure to beryllium in their workplace. We don't have monitoring data for them, but we know by the types of work that they do that they have had exposure, and by the blood tests that we're able to do, determine that they had to have been exposed in a way that resulted in a body reaction, the immune system reaction. There are definitely those high-risk groups and work processes where generally they're associated with the production of jobs that produce a lot of dust and fumes, and that will push extra dust into the air. So some of the earliest descriptions of this disease have been seen in beryllium machinists. I saw many of the workers out of Rocky Flats, for example, from around the country who had machinist jobs. People working in ceramics where the beryllium oxide is heated and compressed and then machined like a metal, generating the dust. People in research and development, people who disturb dust. Some of the surprising cases for us in the early days of trying to understand this disease were seeing people who had janitorial service type jobs, or who were in the job of working as a contractor, where they would get into plenums and different kinds of crawl spaces where dust had accumulated. Construction trades, for example. And then there are lower risk groups. Going back to the 1980s, we were startled when we did our first study at Rocky Flats of a couple of thousand workers out there, and realized that not only were we seeing pretty high rates of beryllium disease among the beryllium machinists, but we also saw it among people like bystanders, security guards, who would have practice drills that took them through a beryllium machine shop from time to time. front office workers where there was potential for dust to have been carried out of one part of a building into another. And also people who are exposed to just the alloys in very small percentage, not pure beryllium, but 1%, 2% beryllium alloys that would then be manipulated in some way. They would be grinding, polishing, sanding them, milling them. So go to the next slide, please. And these are some pictures from different kinds of machining operations. The picture on the right, is a machine operator working with beryllium, and even though there's ventilation set up around it, back in the old days it was not as carefully controlled as we realize now. With a lot more data, we should have been controlling these exposures. So just to get a sense, we have people who use hand Dremel tools, and those spinning tools at high velocities will spin off microscopic particles of dust that can get inhaled into the lungs and can trigger the body's reaction. Next slide. When we talk about the body's reaction, there's actually a range of beryllium health effects, and the ones that we're going to talk about mainly today are the first two. Something called beryllium sensitization, which I'll define in a minute, but I'll give you a preview. It is the body's immune reaction when it sees beryllium as a foreign invader. And then there's chronic beryllium disease. Just to briefly mention, there are other kinds of health effects. People who get beryllium lodged into the skin can develop little lumps under the skin called skin granulomas. There are some people who are exposed to the beryllium salts who can get dermatitis. With very high exposures, people can get an acute pneumonia-like illness called acute berylliosis. That's very, very rare anymore. It was really described back in the 1940s and 50s when they were grossly poorly controlled exposures. Tracheobronchitis, which is inflammation of the windpipe and the upper airways. Conjunctivitis, cases involving the eyes where the dust gets into the eyes. And it is a known human carcinogen. It can cause lung cancer. Next slide. So let's zero in on beryllium sensitization and chronic beryllium disease. Something for people to be aware of is that fundamentally, when we do screening for chronic beryllium disease, what we do is we use a test that measures the body's immune reaction to beryllium. And that's the term for that is sensitization. Technically, it means that there are cells in the body, part of the immune system, that are there to recognize foreign invaders. And one of the invaders that they recognize as being foreign is beryllium. There's no beryllium normally in your body unless you've had an occupational exposure or a significant bystander exposure and you've inhaled it or gotten it through your skin. And the process that goes for the development of the disease starts with sensitization. So with inhalation of beryllium usually, or by skin contact, people can develop the type of allergic reaction called sensitization, and with repeated exposure, with cumulative exposure, eventually it can go on to lead to a clinically obvious disease called chronic beryllium disease, and in some cases lung cancer as well. Those two are separate diagnoses. Not everyone who gets chronic beryllium disease develops lung cancer, and vice versa. People who get lung cancer do not necessarily have to have chronic beryllium disease. Beryllium sensitization, then, is the pathway for the development of chronic beryllium disease, and we'll talk more about that in the next few slides. Next slide, please. One of the studies that we did years ago was we were doing a lot of screening in workforces around the country and then in other countries, and using this blood test, which we're going to describe in more detail in a moment. One of the things that we were trying to understand was, there were some people who would screen them and we would do their blood tests and then we would confirm them and demonstrate that they had beryllium sensitization. And then we would go on and do additional tests to figure out if they already had chronic beryllium disease, even if it wasn't producing symptoms. And we found that many of those people did. But there were some people who were allergic to beryllium. They had the sensitization who had not yet gone on to develop the disease. And we had a group of heroic patients, many of them workers from Rocky Flats and from other plants in the DOE complex. who would volunteer to come in every 1 to 2 years and go through a series of tests to determine if they would go on to develop the disease. And what this shows is that if you were found to have beryllium sensitization and you didn't have the disease when we first saw you, this line going up to the right shows that eventually many of these people did go on to develop the disease, usually with 1 to 2 to up to 6, and even as late as 10 years from the time that we first diagnosed them as being sensitized to beryllium without the disease. Within about 10 years, more than half of them had gone on to develop the disease. The takeaway from this is that if you're found to be sensitized to beryllium, even if you don't have beryllium disease when you're first evaluated, you need to be followed up because there is a certain probability that you will still go on and get the disease later. Next slide, please. So what does beryllium sensitization mean? I'm showing you a picture here, which you won't see anymore. Back in the 1950s, there were some studies done where researchers put small amounts of beryllium salt onto the skin in a little patch. And shown in this picture is 1% beryllium sulfate in a liquid solution that was put on the skin for 48 hours. And then you can see that there's a red welt, a raised area of skin. And that is an immune system reaction. The beryllium has, in that beryllium worker, attracted cells from around the body to go to where the invasion is occurring. It goes right to where the beryllium is and causes this raised reaction. That's an immune system reaction showing up in the skin. We don't test anymore, but you can imagine that this same type of reaction is happening throughout someone's lungs if they have beryllium disease, where they become sensitized, specks of dust get into the lungs, and the immune system converges on the area where the beryllium is found and develops clusters of cells that react to the beryllium that it finds. Next slide. So how do we test for this? The testing for this that's been used since the 1980s is called the beryllium lymphocyte proliferation test. It's a mouthful. Don't blame me for the name, but the test is a measurement. If we break this down, it's a test of how beryllium, very specifically, not any other metal, but beryllium, is affecting lymphocytes, which are a type of white blood cell, which is part of the immune system. Testing how those cells react to beryllium. And the reaction that those cells show is that they start to proliferate, they start to multiply in the body. So it's a test that measures how beryllium causes cells from the immune system to multiply. It's specific for beryllium, and it can be measured both in the blood and also in cells that are washed from someone's lungs, which we'll talk about later, called procedures bronchoscopy, and the lung washing is called lavage, which is a French word. The blood test is what we use to determine if someone is sensitized to beryllium, because it's just a lot harder and more invasive and intrusive to do a lung test. But we can draw someone's blood, send it to the laboratory, and use it to determine if somebody has the beryllium sensitization, that immune system reaction. The blood test itself won't separate whether someone has sensitization alone or if they already have chronic beryllium disease. So additional tests that we'll talk about need to be done in many instances to determine if someone has progressed from having the allergy, the immune reaction, if they've progressed to the disease. Next slide. The test is complicated. It's not fully automated, and shown here is some photos from the ORIU, ORISE laboratory, and what you can see in these pictures are that there's a fair amount of hands-on work that laboratory technicians do. So in the middle picture, tubes of blood have been shipped to the laboratory. They get labeled. They get put into another set of tubes. They get centrifuged so that we can separate out these lymphocytes, these white blood cells. And then we can put them into these specialized plates. We can add beryllium to them. We can then put them in an incubator and then measure whether the cells have started to proliferate. And it's important, I think, to understand that it's not a fully automated test. It can't be fully automated. And so there's a certain amount of room for lack of perfection of any test like this. The same thing goes for every immune test that a doctor might order. Whether you're talking about an immune test for COVID, which we know those tests are not perfect, tests for rheumatoid arthritis, all of these tests that require measuring the immune response have a certain amount of human factor involved in getting the results. And it leads to us sometimes having results that may be ambiguous, and we'll talk about that in a moment. It's a test that's been in solid use with literally hundreds of thousands of tests done in the U.S. and internationally now since the late 1980s. Next slide. So what's going on in this test? In the top panel, you can imagine taking those blood cells that have been taken from someone's tube of blood. We take it from your arm. We separate out the white blood cells, these lymphocytes. We put them into a little dish, actually dozens of little dishes. I won't get into all the details. And then we can put some beryllium in the form of beryllium salts onto those blood cells and see over the next several days when those cells have been put in an incubator whether they start to react to the beryllium. Now in the top panel, people's normal blood, normal meaning they do not have beryllium sensitization, the cells just sit there. They don't start to multiply. If somebody has beryllium sensitization, in contrast, in the bottom panel, one cell that is there ready to recognize beryllium because it's already seen it in someone's body will basically say, "Oh, I'm seeing it again," and start to proliferate, start to multiply. Next slide, please. So when we talk about the results of the blood beryllium lymphocyte proliferation test, there are basically 4 different kinds of results. You can have a negative result, which is a normal result, which means your body does not react to beryllium. And even for people who work around beryllium, the majority of us will never develop a positive BeLPT. We'll never have an abnormal test. We will have a negative test. Positive tests, if you have a positive test, that's an indication that you are beryllium sensitized. So positive in this case means abnormal. It means that your body has seen beryllium before, and now in this assay, in this test, we've shown it beryllium again, and the cells that we took from the body and tested are starting to react just like they would inside your body if they saw beryllium. That's a positive or abnormal test. Some people have a borderline test. To call this test abnormal, we actually test it with certain different amounts of beryllium added to the wells and over several different times during the course of a week. And so we end up usually with somewhere on the order of about 6 mini tests within the main test. And we require that people have 2 or more of those 6 to be called a positive or abnormal result. The details aren't important. What's important to understand is that you can have a result which is, does not meet our agreed to criteria for a positive test, and we call that borderline. Sometimes, in a few percentage of people, we get uninterpretable results, and that can happen for lots of reasons. Sometimes during shipping, the blood may have gotten too hot or too cold during the shipping process. Sometimes there just aren't enough cells to run the full assay. There are a variety of things that can happen along the way to give an uninterpretable test, and for those, we just recommend that the test get repeated. The last thing to mention here is that you can have a false negative test. A false negative test is a technical term for saying that somebody who really does have beryllium sensitization ends up with a test that says they don't. And the things that you have to think about, the things that can interfere with this test. If somebody's on medications that already suppress their immune system. Maybe they're being treated for severe asthma, or they're being treated for rheumatoid arthritis or other immune conditions, and they're on a lot of prednisone or other corticosteroids. Those medicines can interfere with this test because they're already trying to turn down someone's immune system. We take some of those immune system cells, put them into this assay, and those cells have been so calmed down that they won't show the reaction. So sometimes we will get a falsely negative test. There are rare cases of people who truly do have Beryllium disease, but the blood test won't show it. So most of us have a negative test. Some of us will have a positive test, and sometimes we'll get a borderline. Next slide. This test is now routinely used, as I said, in medical surveillance. And by medical surveillance, we mean we're doing screening of people for evidence that they have beryllium sensitization and disease. It has the highest predictive value of the available test, meaning it's the best we've got. It correctly identifies the presence of beryllium sensitization in a large number of studies that have been done, between 66 to 86% of the time. Now, that's important because it's important to note that there are some people who truly do have chronic beryllium disease, but the test, a single test, does not identify them. And hence, sometimes we do repeat testing. The results are considered highly specific. So they're sensitive for, meaning that they pick up a fairly high percentage of the people who truly they should pick up. But they're also specific. So if you have an abnormal or a positive BeLPT, it's caused by beryllium and nothing else. So over 40 years now, it's been used in a wide range of industries, as we mentioned, and it's recommended for surveillance by a U.S. Institute of Medicine panel, Materion and Brush, and the United Steelworkers, the American Thoracic Society, and the test has found its way into both the U.S. Department of Energy beryllium rule and in the 2017 OSHA beryllium rule. Next slide, please. I want to bring this back to the reality, and this was these are pictures from one of the first patients I ever saw with chronic beryllium disease. A man who was both my patient and I would call a friend. He was a worker at Rocky Flats who came to see me at my clinic. At the time, I was working at National Jewish Health. He came to my clinic where I was practicing pulmonary medicine, and he had a cough, chronic dry cough, and shortness of breath. And you know, his friends at the machine shop would say, "Hey, why don't you go see a doctor about that cough, because it had been going on for months." At first, he was told, "Well, we don't really know what's causing your cough." And even after he had biopsies of his lungs, and the very pink-looking picture is actually a photomicrograph. It's a close-up microscopic picture of this man's a piece of his lung. What it showed were these round balls of cells, similar to that picture I showed you of that lump of red skin where beryllium had been placed on a person's skin. What this was showing us were clusters of cells called granulomas that were in this man's lungs, interfering with the normal job of the lungs, which was to exchange oxygen and supply oxygen to his brain and to his organs. His X-ray was abnormal. It showed lots of white specks scattered out through the lungs in a pattern which isn't diagnostic for chronic beryllium disease, but is very consistent with it. In his case, and I present this man's case to illustrate a few points. First of all, is that physicians often are not aware of beryllium disease. They may have read one paragraph about it when they were in medical school. They often don't take accurate occupational medicine histories to know about someone's exposure to beryllium. And so we have to actually educate our doctors to know that you've been exposed to beryllium if you're going in to see them for something that might be beryllium disease. The second important point is that even after all the biopsies have been done and the lung tests have been done, it can still be misdiagnosed for other conditions There's one called sarcoidosis. This man was told he had sarcoidosis. Sometimes people will confuse it, doctors will confuse it with other lung diseases like chronic bronchitis if you don't do enough of the right tests to diagnose it. And then my third point is that ultimately to get the right diagnosis leads to getting an accurate occupational history, knowing that somebody potentially had the exposure. And even if you don't have the exposure, doing the blood and the lung test to prove that it's caused by beryllium. Next slide. If somebody has symptoms for chronic beryllium disease, and I want to tell you right away that most of the people who are beryllium sensitized are being diagnosed with sensitization at a stage before they have any symptoms. It's subclinical when we first pick them up, because we're picking them up at such an early stage. But if somebody becomes symptomatic, what would be the symptoms that you would likely have? Cough, usually a dry, persistent cough, is very common. Shortness of breath, especially with exertion. In the later stages, people can experience air hunger. Blue nail beds, which is an indication of lack of oxygen getting into the peripheral blood. Sometimes night sweats, fevers, joint aches. As you can see, these are not very specific, right? You can think of lots of different diseases that can produce those symptoms. But when they're persistent, and you know that you've had beryllium exposure, or especially if you've been beryllium sensitized, then we're on the lookout for these symptoms to occur. This disease generally has a slow onset over a course of months and years. I mentioned acute berylliosis, but that's a very rare thing. I've in my career, I've never seen somebody who had acute berylliosis, because by the time in the 1980s, when I started taking care of patients with this disease, and I've seen well over 1,000, people were already working in an era where they were not being as grossly exposed as in the very early days of the 1940s. Slow onset, slow gradual worsening over time. Sometimes it can have a more accelerated clinical course over a series of months, but usually it's over the span of months and years. Next slide. So one of the questions that come up is if you have a blood test that's done, a BeLPT, and it's called abnormal or positive, when should a clinical evaluation be considered? The gold standard is to say that if you have a confirmed abnormal or positive BeLPT, which means 2 or more positive tests, that's somebody who is confirmed to be sensitized and should see a physician who specializes in the evaluation of people for chronic beryllium disease. We also know that having 3 or more borderline tests, done on 3 separate occasions, if you keep coming up with a borderline result where 1 out of the 6 mini tests is abnormal, but you don't get the full-blown picture of a positive test, well, those people usually turn out to have chronic beryllium disease as well. So although that particular criterion is not yet accepted under the law by EEOICP through the Department of Labor, we do know, and clinically we know that those people should be evaluated because there's a good chance that they would be found to have chronic beryllium disease. We also recommend clinical evaluation when somebody has symptoms that could go along with beryllium disease, if they have the abnormal X-ray, like my patient who I showed you there, or if they have a CT scan that's consistent with chronic beryllium disease. One positive test in the presence of symptoms or abnormal lung findings should also trigger a clinical evaluation. So even if somebody hasn't had a second abnormal BeLPT, even with one positive test, if you've got the symptoms that go along with it, many of my patients in that situation have turned out to have chronic beryllium disease, even without repeating the blood test, going straight to lung evaluation. Next slide, please. In terms of the diagnostic evaluation, clinical evaluation should be done by physicians who are experienced in the diagnosis of chronic beryllium disease, because it's going to determine one of several things. You will come out after a series of tests. If you're sensitized, either being told you're sensitized, but you don't yet have chronic beryllium disease, you're at some future risk, so you need to come back and be seen again in the future. Often we'll do that follow-up in 1 to 2 years, depends upon how suspicious the physician is of progression. You may be found to have chronic beryllium disease, but at a subclinical stage. You have no symptoms, your lungs are still functioning well, but you have the spots in your lungs, you have the granulomas. We call that subclinical disease. It's not yet at a point of having symptoms. Or you would be diagnosed as having clinical chronic beryllium disease, where there's presence of symptoms or abnormal lung tests that show that the lungs are not functioning the way they should, and you've been confirmed as having abnormal reactions to beryllium by cells in your lungs. And the other reason for doing diagnostic evaluation is to determine if you're in one of these categories. So you either have chronic beryllium disease now or you're just at risk for the future. And to determine if and when treatment is going to be needed. Next slide. Not everybody needs every test. And that's why you want to see someone who specializes in the diagnosis and recognition of chronic beryllium disease to determine what tests should be done. But typically, the diagnostic evaluation would include measuring how well your lungs are functioning. We want to know how deep a breath can you take? Are the scars in your lungs preventing you from taking a deep breath? And there are tests for that. We also measure oxygen levels in the blood. We can do it with a measurement on the finger, sometimes a direct measurement from an artery. Sometimes it's done with somebody on a treadmill or an exercise bike, because to bring out the evidence that your lungs are not functioning normally, we will put somebody through some exercise, and if their oxygen level starts to drop while they're doing exercise, that could be an indication of a reaction to the beryllium. If somebody doesn't have any contraindications, we generally recommend bronchoscopy. And this is a test where people are put under a light anesthesia. It's done as an outpatient. And after numbing up the nose and throat, a skinny tube is passed through the back of the throat into the lungs in order to do several things. One, we take some biopsies. We remove little bits of lung tissue that are smaller than the tip of my pen. And those are then put under a microscope and looked at by pathologists to see if those scars, like I showed you in that one picture, that very pink picture, whether there are scars that are caused by beryllium. Secondly, while we're in there, we also do a lung washing, lavage. And that is to retrieve cells from the lungs, which then we put into the same test that the blood is put into, except now we use lung cells. And we test those lung cells to see if they react to beryllium, because the immune system, if you have beryllium disease, has sent millions of immune system cells into the lungs to react to the beryllium. We're pulling some of those out in the washing, and we're testing them to show that beryllium is in fact causing them to accumulate in the lungs. There are some alternative tests, but these are the main tests that would be done to try to get to the diagnosis. In some cases, in some instances, doctors may not think that it's necessary to do the lavage. Sometimes they will recommend against doing the biopsies and do the lavage only, just because of potential risks. And sometimes, with the combination of the abnormal blood test, the positive blood tests, plus a typical CT scan, that by itself may in some cases be enough to make the diagnosis. So there's some subtlety here, but I wanted to give you a sense that the main things we do is we want to see how well your lungs are working by measuring lung function and oxygen, and getting the definitive diagnosis through bronchoscopy if necessary. Next slide. I want to just say a bit about treatment. Treatment is not curative. The best thing to do to not get beryllium disease is to not be exposed to beryllium. Treatment, once somebody has it, is dedicated to the task of reducing or stopping the progression. And number one is removing somebody who's sensitized, removing them from continued exposure. For those of you who are in the former worker program, presumably you're no longer working around beryllium. You should not be. If you're beryllium sensitized, we recommend removal from parts of one's job where you would be around beryllium. If the oxygen levels are low, then the physician may be prescribing oxygen. We generally recommend that people stay physically active. Some people will benefit from pulmonary rehabilitation programs. We do, in some instances, use medicines to calm down the immune response. That includes steroids like prednisone. Methotrexate has shown some benefit in reducing how much prednisone might be needed to treat it. And there has been some experiments done, some studies done using other medicines that suppress the immune system. Unfortunately, most of those medications produce side effects. And so we always have to monitor people carefully for any side effects of the medications that are used to treat the disease. We generally reserve treatment for when there are signs that the disease is progressing or someone's oxygen levels are already low and we're trying to regain some ground that's been lost. We continue to monitor people for response to treatment and for disease worsening. Treatment has been shown to slow the progression of the disease, but there is not a cure. And so treatment has to be focused on what can we do to prolong someone's life and to also maintain a high quality of life. Next slide. With this, I want to turn it back over to my colleague, Dr. Stalker.
Okay, I'm trying to be conscious of time here, so we're going to kind of rush through these slides so we can get to the Q&A. I have had a cough drop, so hopefully my voice is coming over less scratchy than it was earlier. Thanks, Lee, and I just want to add a couple comments on the presentation. Another thing that we advise patients is to stop smoking. It's not a treatment, but certainly continuing to smoke does complicate things for people that have lung disease related to beryllium. Also, I want to reinforce what he brought up about the lack of knowledge about beryllium disease in the common medical world. I personally think that I probably had one lecture that might have mentioned beryllium disease as one of the pneumoconioses, but otherwise fancy term that they use in the medical field. But I actually have made it sort of my mission, having worked for the DOE complex for over 20 years now, bringing attention to other medical providers that are not in occupational medicine to understand that when they're seeing patients, the importance of taking an occupational history and being aware that there are hazardous exposures that might have occurred in the worker settings. So, in this slide, I felt like I kind of left you hanging with the question about what sites had beryllium present. It's probably because we didn't have a good answer for that. This slide covers information that the former worker program has gathered in an attempt to try to answer that question. And this information is from testing former DOE workers to see if they are sensitized to beryllium. And details on information for specific sites for any of you that are interested can be found at the link provided at the bottom of the slide. First, what I can tell you is that all DOE sites have had at least one sensitized worker. Interpreting where the exposure actually occurred, however, is sometimes difficult, as many workers we have found have worked at multiple sites. Also, the percentage of workers that have abnormal results varies from site to site. On this table at the bottom of the slide, which is information through 2022, we can see that over 1,007 beryllium tests have been performed. And I want you to be aware this is not unique individuals, but represents the total number of tests performed. And of these tests, 1,181 individual participants, or 1.1% of those tested, were found to have one abnormal BeLPT. 1,006, or 0.93%, had two abnormals, and 393, or 0.36%, had one abnormal and one borderline test. Let's go ahead to the next slide. And this slide represents why we do health screenings that include beryllium testing for our former workers. What we've learned is that sensitization and chronic beryllium disease are sometimes not detectable until long after exposure, though the majority of sensitized individuals will have an abnormal BeLPT test or beryllium test within the first year of BE exposure if they're being tested. If we look at the graph on the left, we can see that 80,567 BeLPTs were performed on initial health screenings. 933, or 1.2%, were found by the former worker program to have new abnormal BeLPTs. This includes individuals who had prior normal testing and those who had never been tested. The rest of the information on the slide, both the graph and the table, relates to information about rescreening examinations. As of 2022, the former worker program has performed over 27,000 Beryllium tests at rescreening exams, and this includes all rescreenings, not just the first rescreen, and another 248 new abnormal BeLPTs were identified. It's important to note that these 248 that were discovered on rescreening did not have an abnormal or borderline result in the past. These were true new abnormal BeLPTs. It's also important to note, as former workers continue to have repeated normal BeLPTs over time through the rescreenings, that typically after the third normal test, the possibility of an abnormal BeLPT or Beryllium test without further exposure approaches zero. And I'd like to thank Dr. Donna Craigle, who's an epidemiologist with ORAU and ORISE, for her help interpreting this information. So to summarize, beryllium sensitization and CBD, as well as other occupationally related diseases, can have delayed onset after exposure, and that is why we continue to screen for these in the former worker program. So very quickly, just points that I want you to take home at this time. Beryllium is a valuable metal with important qualities for the DOE mission. It has been utilized in the past without appropriate engineering controls, which has resulted in exposure of workers who worked with beryllium and also legacy exposures from site contamination for those individuals that were not specifically beryllium workers. I think it's important to realize that beryllium is valuable and can continue to be utilized with the proper engineering controls. As Lee mentioned, DOE and OSHA both now have rules in place that regulate the use of beryllium to protect the workers. Safety culture at active DOE sites where I come from is present and working, and DOE closely monitors this regularly. Next slide. Important things to understand about CBD and sensitization. As Lee mentioned, not everyone who is sensitized will develop CBD. And sensitization, I want to emphasize, is not a disease. It's an immune reaction, as Lee said, whereas CBD is. Not everyone will become beryllium sensitized nor develop CBD, but the former worker programs monitor for this by offering health screenings every 3 years. DOL, or Department of Labor, provides benefits to those DOE former workers who become sensitized or develop CBD. And Department of Energy, Department of Labor, and the former worker program serve as resources for information direction for former DOE workers to ensure they are aware of and can apply for these benefits. Next slide. And there is a difference between the Department of Labor interpretation of abnormal results. They only require one abnormal BeLPT for benefits. And currently borderline tests, just to reemphasize, even 3 or more do not qualify for DOE, Department of Labor benefits. In the medical community, doctors like to see that we've verified abnormal results. So we still like to see 2 abnormal BeLPTs to verify beryllium sensitization, but we're also not as didactic as the laws that govern DOL, and we'll take 1 abnormal or multiple borderlines with positive lavage from the bronchial airway or clinical evidence of chronic beryllium disease, and that results in our assuming that the person has beryllium sensitization. That's all I have for today, and I think I'm going to turn it back to Zach so he can wind things up because I know we're close to time.
Thank you, Dr. Stalker. Thank you so much to you and Dr. Newman for this very informative presentation. We have a lot of people to thank for putting together this webinar, but in the interest of getting to the Q&A, I will skip right to that. So Dr. Stalker and Dr. Newman, we've had a number of great questions come in already. And one I see here, there are actually 2 that I think go together quite well, so I'll ask them both to you. And one is, how long is the average time frame between initial exposure and onset of disease symptoms? And the follow-up to that is a person saying that it has been 40 years since they worked with no direct exposure to beryllium. And they have had the 3-year blood tests with negative results. Do they need to worry about the future since the disease seems to progress?
Yeah. So why don't I take a quick shot at those, Zach?
Go ahead, Lee.
So in the first one, it's widely variable how long it takes from time of first exposure to the onset of symptoms. Generally, people have had higher exposures, people who work, say, in a machine shop where there were poorly controlled dusts, or maybe around a furnace area with poorly controlled fumes, may have a more rapid onset. We've seen people develop symptomatic disease with chronic Beryllium disease within 1 to 2 years, but it's more usually within about 5 to 10 years from time of first exposure that the symptoms really start to kick in. The sensitization can be picked up, as Dr. Stalker said, within the first year after exposure, but the symptoms may not show up until 5 to 10 years later, typically. Did you want to take the second part of that, Jamie, or do you want me to? You're on mute. I can't hear Dr. Stalker.
Oh, no, I said, I think that covers it, and we should probably try to take another question since we don't have a lot of time.
Sure. Thank you, Dr. Newman, for that response. Another great question here is, do borderline tests become positive cases over time?
Yes, they do. I do want to finish up on the previous question, though, which is that if you're 40 years out and you've come back every several years and you've had now 3 negative tests, you're probably out of the woods. The probability of coming up with an abnormal test that will lead to any degree of lung impairment and symptoms is extremely low.
Yeah, and I hope I had covered that, but we were moving pretty quickly, so I'm sorry if that got missed, and the question might have come in earlier. Yeah. So go ahead, Lee. What was the question again that you had, Zach? The next one?
The next one was, do borderline tests become positive cases?
Yes, they can.
Yes.
And if you have multiple borderline tests, you should be evaluated and monitored just as you would if you had positive tests.
Yeah, and I could add to that. There is really the medical community that's involved with the DOE complex and the medical board that provides support for DOL really does have a proposal going forward that 3 borderlines become accepted as equivalent to an abnormal BeLPT. I think it's moving forward, but it's going to take time. It has to go before Congress, and as we all know, that can take time as well. So we're all advocating for that. Because we know that is what should happen, but it's still going to take time, and currently it is not covered under DOL.
Thank you both for those responses. We have just a few more minutes. One question I've seen come up more than once in the Q&A is apparently possibly from folks who are not currently enrolled in the former worker medical screening programs. Several people are asking how they can get a BeLPT.
Well, there are 3 labs currently that do BeLPTs, but you're going to find that if you go to a primary doctor, they're probably going to order the wrong test, which will be a beryllium blood level. We see that frequently, and that really doesn't tell us anything and does not count towards beryllium sensitization. It is probably best if you're a former worker, and I assume this was former workers that were asking that you reach out to the DOE former worker program, find what program you're covered under based on your site, and get enrolled so you can get the health screenings. Did I miss anything with that?
No, absolutely. I would totally agree. Thank you so much. Another few questions, since we do have a couple more minutes. Is there a genetic component to beryllium sensitization and disease?
Yeah, let me respond to that. There's been a lot of research done on that, including my lab and other researchers around the world. We do know one thing for sure: nobody gets beryllium disease unless they have been exposed to beryllium. Mm-hmm. So that has to be remembered. Yes, there are genetic differences that can be found more commonly in people who develop beryllium disease and who develop beryllium sensitization compared to those who are exposed and don't get beryllium disease. So there is a particular marker in one gene that conveys an increased risk if you are exposed. But the bottom line here is that there's no genetic test that can or should be used to make decisions about diagnosis or treatment, or even as to whether you should work in a Beryllium facility or not. The driver for that decision should be, is it a place where beryllium exposure is well controlled and prevented?
Thank you so much, Dr. Newman. I see a few folks asking questions about, about how they can get in touch with folks to get screened if they're a former DOE worker. So I just wanted to make a quick announcement that if you are a DOE former worker and you're not enrolled in a former worker medical screening program, please do visit the DOE former worker program medical screening website, which is, the URL can be found at the bottom of the slide here. Also, if you Google former worker screening program DOE, I'm sure you will be able to find that site. We are also going to make this video recording of this presentation available, and everyone who registered for the webinar will be notified about how they can access that. I think we have time for one more question. Why have some of the people I worked right next to become sensitized to beryllium and I haven't?
Yeah, it's a great question, and there's not a simple answer to it. Genetic risk can contribute to that difference, although the main gene that's associated with the increased risk is present in 45% of us on average. So almost half of us have a gene that makes us somewhat more susceptible. There may be other reasons, but including where the beryllium dust or fume or mist is traveling in the air, how close or far you are from ventilation that may be pulling it away, whether you are or are not using respiratory protection. So there are a lot of different environmental factors that could also influence that risk. Not a simple answer, but the goal then is to minimize the risk as much as we can for everyone, knowing that some people are going to be more likely to develop sensitization and disease than others.
Yeah, and I'll just add what I like to say to that is the immune system is a crazy system, and we don't have a full understanding of how it works. It's sort of like, why do some people get sick? Why do some people develop autoimmune disease? Why do people have different allergies? And they may be genetically very similar, and they don't all react the same way. And it's because the immune system is very complex.
Thank you, Dr. Stalker and Dr. Newman. Unfortunately, we are out of time, so we won't be able to get to any more questions today. But I just want to say on behalf of the DOE Former Worker Medical Screening Program, thank you all for attending today, for your time and attention. And don't forget to send us your feedback via our brief exit survey. We really do appreciate your responses. And that's all we have for you today. Thank you so much.